To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
This is a whole-of-nation approach, whole-of-America approach. We're part of it. We got the hospital ships. We got Army Expeditionary Hospitals that are built up in the Javits Center in New York City. We're doing the same thing in Seattle. We're bringing stuff down to New Orleans, to Dallas, and we're postured to bring even more. We are part of this fight. Our Commander-in-Chief has declared a war on COVID, and we're treating this like a large military campaign.
To respond to the growing needs of our nation, the Department of Defense has evaluated a variety of medical capabilities available to meet the needs of the lead federal agency. One of the options which met the desired end state was a U.S. Army Reserve concept known as the Urban Augmentation Medical Task Force, or UAMTF. A UAMTF is comprised of 85 medical personnel possessing specialized medical skills. Their mission is to augment healthcare systems in select urban areas to ease the strain on local healthcare professionals. The Department of Defense activated 15 task forces in the fight against COVID-19.
And as we've expanded our operations to more than a dozen states, we've implemented an adaptive medical concept of operation. And this is based on lessons learned in the three-pronged approach we employed for New York City, and we've developed 3 conditions-based expeditionary medical force employment options that are dynamically scalable and tailorable.
The 3 models under which a UAMTF can deploy are the fully equipped model, used in New York City, Boston, Philadelphia, and Detroit. The embedded model, used broadly across New York and New Jersey. And the extended capacity model, which was used successfully at Stanford Health in Connecticut to expand existing medical infrastructure.
For the patients is very similar to that of the hospital. We just don't have the 4 walls. There are meals provided and catered in through our dietary services. We have physical therapy and occupational therapy that come in and work with them to help transition them out to either home or nursing homes as the case may be. We also do our medications with our pharmacy to make sure they get their daily medications for chronic illnesses such as COPD or heart conditions. We try to take care of them as close as we can to what they would receive in any other hospital facility.
What we end up doing is we are kind of putting in a plug-and-play model. So we have doctors, nurses, PAs, nurse practitioners, healthcare providers that all have been able to come into this area and work alongside the hospital staff, work with them to take care of any of the patients, mental patients or medical patients.
The team that I brought here is doctors, nurses, medics who do this in their civilian side, so they're a very experienced group. We took over one of the floors at the hospital and we completely took it over. So all our doctors, nurses, medics, everyone actually just had that floor. And then also the National Guard fixed up an extended care area, which was an old hospital that hadn't been used for 4 or 5 years. So the National Guard came in, they took an old building that hadn't seen anything for quite a while, they cleaned it up, they put beds in it, they made it completely 100% functional, so we were able to do another unit there.
We're operating within the United States, and we're operating in support of FEMA. FEMA is the lead agency, and so the states have asked for some certain capabilities that they need for a limited time, for example, these medical task forces. And what I do is I make sure that the right capability is being used for the right purpose. I also ensure that the duration of the mission is not enduring, it's limited. And then I also provide the conversation, the dialogue with each one of the states, basically governors, the adjutant generals, and I socialize the employment of the Title X force with them.
Whether the nation's interests necessitate the Department of Defense as a lead federal agency or act as a supporting element to other federal agencies, the scalable and adaptive expeditionary medical option, the UAMTF, enables combatant commanders at home and abroad to ensure any medical needs can be rapidly met. This ensures that the Department of Defense brings the right people to the fight, whether on the battlefield or shoulder to shoulder with our civilian counterparts in the rapid manner that American people and the global community have come to expect. Together we remain, always ready, always here.